Welcome, everyone. First and foremost, thank you for joining us today for this info session on the Health in the Public Interest Program. All right, does it look like the slides are coming through?
Yes.
It's good.
All right, excellent. All right, so welcome, everybody. We're really excited to have you here and share a little bit more about our program, what makes us unique, and when you're thinking about applying, things like our career outcomes, just everything you need to know about the program. So today we'll start with some introductions of the staff and faculty that make up our Masters of Science program, Health in the Public Interest. We'll go into a little bit of the general program overview, career opportunities and alumni outcomes, look into admissions and what you need to know when applying to the program, and have some time for all of your questions at the end. So my name is Jennifer Jansen. I am the program coordinator for the Health in the Public Interest program. Essentially, I'm here for any questions that current and prospective students have about the program. I'm here for things like financial aid concerns, admissions concerns, elective and registration concerns. So you're welcome to contact me about any of those needs. And if needed, I can direct you to the right office or give you a helping hand myself. From there, I will pass it off to Dr. Myers, who is one of the co-directors of the Health in the Public Interest Program.
Welcome all. It's a pleasure to have you here today. I'm co-director of the program, as you just heard, with Dr. Adrian Fu Berman, with whom I've been working on graduate programs for a long time. And in this program in particular, this is our 7th year. By way of introduction, I'm a former member of the medical school at Georgetown faculty, where I taught cardiovascular physiology, did research in that area, and eventually got interested in coming up with integrative and exciting new graduate programs, which is how I ended up working with Dr. Fu Berman, who is here. And would you like to go ahead and introduce yourself?
Sure. So hi, I'm Adrian Fu Berman. I'm trained as a physician and I'm a professor here in the Department of Pharmacology and Physiology and also the Department of Family Medicine. I direct a project called Farmed Out that does research and education on how the pharmaceutical industry manipulates the prescribing habits of physicians. And Dr. Myers has also been involved with that since the beginning. So we've worked together at this point for a couple of decades on various projects. And the Happy program really there's a we're really hoping to create effective health advocates out of our graduates, and we have a lot of experience in doing that. Jenny?
All righty, let's talk a little bit about our faculty.
Oh, okay, yeah. So we've got a really fantastic faculty. So Tony Shalley teaches on theory and methods of epidemiology. I also help teach that course. And Yulia Dutton's this amazing cultural psychologist who she runs our Health Society and Disease program, which is the first course that the students take. It's a 3.5 week course right before the fall semester begins, and it's a really great course where it's taught by both cultural psychologists and anthropologists and sociologists. So it's a really great introduction to the social sciences, which is a lot of the underpinnings of the program. And Dr. Golding actually works full-time at Children's Defense Fund and is a great adjunct faculty member who teaches health communications in the spring. Next. And Pam Saunders is a linguist who teaches the second part of theory and methods, where we introduce you to qualitative research. So the first part of theory and methods of epidemiology, the first part of theory and methods is epidemiology, more quantitative stuff. And then in the second semester, it's more qualitative stuff. Sarah Knight Marver teaches biology of health and disease, and Dr. Turbet teaches our health economics course. So we've really got like a wide variety of courses that's been very well integrated with each other to give you a very cross-disciplinary perspective. Next. And Dr. Sherman teaches nutrition courses and also biochemistry. And Dr. Weinstein teaches a variety of courses on international health and other subjects as well. She's a very well-known demographer. So Georgetown we're a great school. We have this nice campus in DC. We've actually been expanding the campus to various parts of DC, and in the program you will really have a lot of interaction with people from very different backgrounds. And DC is a really great place to study. There's like a lot going on here. There's a lot of meetings, and you know, we say in DC local news is national news, because we're really just in the thick of it, in the thick of political things here. Everybody talks politics all the time, and it's a great place to learn. Next. Is this still
I can take over if you
Okay.
want. Should I start?
Sure. Yeah.
Okay, so why the health and the public interest program? Excuse me. So coming from a medical school background, teaching there, and Dr. Fu Berman being a clinician, you know, when we started out, we learned to look at medicine largely from a scientific and clinical lens, but more and more, all of us have come to understand that health is something that's affected as much or more by factors that are non-medical, societal factors, economic factors, psychological, cultural. All of these things intersect with corporate, institutional influences, legal things to affect people's health. And healthcare disparities has really become the focus of a lot of research, how social factors, fiscal factors, legal things play into health in terms of health in different parts of the population. So we're working in an area that's receiving a lot of attention today, and we have come to understand that the challenges that we face today require critical solutions that not only look at just what's good medicine and what's good healthcare administration, but what are all these other things doing to our healthcare and health landscape. Too much, I think, today, the first gut reaction to healthcare in discussions is to think about, you know, simply money and politics. But money and politics isn't what affects our health so much as all of these other things that we talk about. So the curriculum has several core courses, the Health, Disease, and Society Team Talk course that Dr. Fu Berman mentioned, health advocacy, which she will also talk more about later on, but it's an important topic, you know, not just to learn about factors that affect health and healthcare, but how to do something about it. And as a program, what we really want to do is train people who want to go out and make a difference in the healthcare world, who want to leave their imprint and work toward social and health justice. We have a course in biology of health and disease that reflects the fact that we take people with all kinds of academic backgrounds, and this course teaches the basics of biology and disease so that everyone ends up sort of at a level understanding of those fields so that then they can apply the more interdisciplinary outlook. Health economics, taught by Dr. Turbat, is offered in the spring. Theory and methods of inquiry. We have 1 and 2, as Dr. Fu Berman mentioned, and the healthcare communication taught by Dr. Golding. Next slide, please. So We're going to have an overview of the program. Next slide, please, which then shows these courses in context of summer, fall, spring, and the second summer. But what I want to say right now is some generalities related to the time of the program, et cetera. It's a 1 year program. If you take it full time, it's available part-time. We'll get back to that perhaps. That's a 2 year option. It's kind of held together throughout the year by a seminar series that brings in experts from the field of public health and social sciences, et cetera. The course consists of 30 credits, as you can see on the left, 27 core courses, but it leaves room for 6 elective course credits. So what that means is that you'll have at least 2 courses that you can select from various parts of the university. It could be, from the from other graduate school programs, or it could be from the Law Center or McCourt School of Public Policy, the Medical Center. It allows you really through these 2 courses, as well as your capstone project, which Dr. Fu Berman will describe, to kind of allow you to knit your program together in a way that will emphasize your particular passion and interest in the health world. If you're interested in, let's say, women's health or reproductive justice, there are courses that we can recommend that will help supplement these core courses and kind of make the program fit your ideal idea of what you want to do with your career. This is unlike most public health programs or other health sciences programs that tend to have a pretty rigid curriculum, especially if they're offered in a 1 year time frame. So it lets you do what you want. The total tuition for this program, we don't have yet for next year. The current tuition is about $60,000. It's a lot of money. We do have some merit-based financial aid that we offer to qualified students. It's never going to cover your whole tuition, but it can at least take some of the sting out of that high price tag. Next slide, please. So going on to what those courses look like in terms of the year-long curriculum, the Health, Disease, and Society course is taught in the calendar summer in August, but it's actually considered part of the fall semester. It's a fall pre-session taught in August. And then when you get to the fall itself, there are 12 additional credits that you take in theory and methods, biology of health and disease, health advocacy, seminar, and the elective course I mentioned. And then in the spring, you take another 12 or 13 credits. The second part of the methods courses, the economics course, communications, seminar, and elective. So you see how it's kind of spread out over the summer, and then, the pre-fall, the fall, the spring, and then the final summer session, which is the capstone or internship that Dr. Fu Berman will describe. Next, please. Yeah. Okay, so we mentioned the part-time schedule. Some of you may be interested in doing this program while you work. In that case, we strongly recommend you look at a 2 year schedule. It's laid out here. I won't go into any details, but it's basically the same courses spread out in a way that makes sense in terms of the pedagogy and content over 4 semesters, and then the fall pre-session, and then the final summer. So next, please.
I just wanted to add there that we've actually moved around most of the classes. So most of the classes start around 4 o'clock, so that it gives the students who are working a chance to put in a full work day. The summer course the 4-week course, that's really full time. It's really difficult to work full time during that time, although many students have worked part time. But during the year, most of the courses are after 4.
Yeah, thank you. And that reminds me of something else that I was trying to remember to talk about, and that was the fact that from our experience, you can do one or the other full time, work or go to school, and then the other one has to be part time. So we've had students who have successfully navigated this as full time students, working part time or doing a part time internship sometimes. DC is great in that there are internships throughout the year that are a little easier to get sometimes than the summer internships that are highly sought after by, the whole nation. And then we've had students who worked full time and went to school part time according to the schedule I just had on the previous slide. So either way, one full time, the other part time. Some students choose to just do the program full time. School can always take up as much time as you want for it. And that's also can be a very rich experience without the part-time work or internship. But you have to find your own way in this, whatever it suits you best. Next, please. Oh, so this is sample electives. And what I want to point out here is that these are just names of courses, but you can see that they span a wide swath of subjects, everything from environmental health to infectious disease, sex law and policy. Um, these are things that are taken at from various sectors within the university. These aren't our own courses for the most part, although Dr. Fu Berman does teach the medicinal plants and pharmacognosy course. But again, one of the things that we encourage students to do is talk to us early and design your own program. There are plenty of courses in global health, for example, for you to take extra global health electives both semesters, and perhaps you can find a capstone that involves that involves global health, etc. So next, please.
So I
So
can take over here.
yes.
It's fun to see slides of our former student. But so the capstone project is usually done in the summer. Sometimes students will do like a part-time capstone over a longer period of time, or sometimes students have done it in a fall semester in the second year. We wouldn't let you do it fall semester in the first year because that's really the first semester. But they've done capstone projects all over. So capstone can be an internship, like a job, a job type internship. It can be an independent study project. It can be working with a researcher in either qualitative, quantitative, or scientific research. So there's like a broad variety of things that people have done. So people have worked in the government. They've worked for NIH and other places. We've had students do internships with Farmed Out. We've had them do internships at a variety of nonprofits, including Public Citizens Health Research Group, for example, and some have worked for like a state or local government, or research, some international projects and some research projects at Georgetown or other places. Next slide. And yeah, these are just some examples of some agencies and nonprofit groups, and also for-profit businesses that that people have done internships or capstones at. We actually had 2 students work independently on writing book proposals, and one of them recently published a book. Next slide.
So seminar is a course that I direct in both the fall and the spring semester. And in a way, it's kind of the glue that binds together a lot of the objectives of the program. Shown here are a couple of the speakers we've had in the last 12 months. Dr. Johnson talking about the Ebola epidemic in Africa and his firsthand experience in fighting it in the early stages on the ground in Africa. Dr. Anthony Fauci is a member of our faculty. He gave a great seminar several months ago and talked about basically about his experiences with the pandemic, with the administration during the pandemic, et cetera. Very fascinating stuff. I've had lots of other well-known and great speakers. I want to talk a little bit about how seminars are run because it says something about how much we care about developing all aspects of your professional development. When we start to put together the seminar series, one of the things that we always ask is, do you have suggestions for topics or people? And oftentimes students would have someone who they knew as an undergraduate who was perhaps a mentor or a very special influence on them. We can always consider such suggestions. And when students do that, it then allows us to get people that we don't know, perhaps, for the seminar. And when we run the seminar, students have a big role in it. They can suggest speakers, they moderate the seminars, they talk to the speakers beforehand to learn about them so that they can introduce them properly. It's learning how to network, right? And it's expanding kind of the group of people that you know. So during the course of the year, you'll have perhaps 3 seminars that you moderate and get to meet the speakers and network in that way. Now, throughout the program, so this is one opportunity for molding the program to your ends, that is by suggesting or identifying potential speakers. Another one is the electives that we talked about. A third one is the capstone project. If you're really interested in some specific aspect of public health, we can help you identify a place. Perhaps you can identify it yourself. It could be at Georgetown, it could be elsewhere. Another final way that you can adapt the program is through the advocacy course where Dr. Fu Berman has groups of students work on projects. She'll talk more about that later, but again, you suggest your own group's project and it's then approved by Dr. Fu Berman. So you have a lot to say about the nature of your education and the content. We have the backbone there for you, and then it's up to you to kind of fill in the flesh and of the program and make it something that's pretty individualized in the end. Next slide, please. So alumni career path. So I've always been impressed by the fact that, our students always end up with jobs. And sometimes we help them, and sometimes, by the time it comes around to the end of the program, they already know what they want to do and where they're applying. Our students go into the public sector, working for government agencies or related things, perhaps in advocacy or research or whatnot. Sometimes they go to associations or NGOs, nonprofits, lots of different places, and some of them are listed here. So, I can't read that, sorry, but a number of foundations, the Health Resources and Services Administration, the Lombardi Cancer Center at Georgetown has great programs that have to do with not only with cancer, which is their primary focus, but also with healthcare disparities in the area of cancer. We have farmed out on that list. Dr. Fu Berman has that organization, which looks at rational prescribing and influences of marketing on drugs and prescribing. So lots of different ways to go, and you choose your career path. We'll help you get there by perhaps helping you find a capstone in that area, introducing you to people, etc. Next slide, please.
All right. So now I'm going to take over to talk a little bit about admissions, what to expect with financing your degree, applying for the program, and everything in between. So here is an application checklist for what we would require should you be interested in submitting an application. This is all handled through an online portal on the Georgetown website. The first thing we need from you is the completed application form, of course. One really nice thing we're doing is before January 15th, the priority deadline, if you manage to get your application in, that fee is waived. So unless you happen to apply later, we have a rolling deadline to April 1st of 2025 for the next cohort. So if you apply after January 15th, that's a $90 application fee. But if you apply before that, by the January 15th deadline, you don't have to worry about that, which is great. We require a 500-word academic statement of purpose where you can use that to discuss your academic journey, what brought you to apply to the program, your personal goals, and what you hope to get out of it, and the like. Although it's listed as optional on the application, we really strongly urge students to fill out the optional statement on personal background. This is just another 500 words that gives you the opportunity to expand on your personal background, your experiences, and how they contribute to your interest in this field and this program specifically. This is really great because we welcome any opportunity to get to know you more through your application. And it also helps you demonstrate that you're going to be an active contributor in our community because, as you can see from having a health advocacy course in the curriculum, we are really invested in people being involved and getting involved in these fields. Next up, we require a writing sample. This does not have to be tailored to the application. This is just used to assess your preparedness to write at the graduate level. So most commonly, students will submit things like research papers or capstones from their undergraduate degrees. However, we also welcome things like op-eds or technical reports. So just try to show that you are skilled at writing at the graduate level. We also require your resume or your curriculum vitae and 3 letters of recommendation. If possible, please try to have one of your recommenders be an academic you have worked with, like a professor. You can use responsible individuals from a work environment, but having at least one from an academic is great because it shows us what you're like in a classroom and educational environment. This is also managed through the online portal, so you'll just have to enter contact info and the email of your recommenders in there, and they'll receive email instructions from there on how to complete the form. And from that portal, you can also send reminders and check the status of your letters, which is helpful. As soon as it's available, we will need your transcript with your undergraduate degree on it for those of you who are currently completing an undergraduate degree, like a bachelor's degree. We will accept an unofficial transcript by both the priority deadline and the final rolling deadline. But in order to make a final decision with the graduate school on your admission, we do need that final official transcript that confirms you have completed an undergraduate degree. So again, you're welcome to submit the unofficial one at first, but just keep that in mind. Finally, for those of you who did not attend an English language school or are international students, the university requires a demonstration of English language proficiency. You'll see on the right the minimum scores required to be eligible for admission. And we do not require a GRE, which is really great.
So if I can interject, one of the common questions is, what can I do? We're coming up on the deadline and my professor hasn't turned in their letter yet. So these deadlines are for you to turn in the completed application form and, if required, the application fee and all of the things that you do as part of that, for example, attaching a resume, writing sample, etc. But the actual letter, the transcripts, you need to request them and you need to tell us where they're coming from, and we'll give you, another week or 10 days or so after those deadlines, before we're going to start bugging you for them.
Yeah, thank you for that. All right, so what does it take to be eligible to be considered for the program and for admission? First of all, an applicant needs to hold a bachelor's degree or an equivalent from an accredited institution. Secondly, we are a program that really cares about being involved in our community, and we really want people who are going to be active participants in the program. So as such, demonstrated interest in public health related fields such as healthcare, health equity, reform, and advocacy are strongly preferred. Especially if you have something like work experience, fellowship, or internship experience in the field, that's a big leg up. That's not a requirement for work experience, because we know we do have a good amount of students who come straight from an undergraduate degree, but we really just want to see that you're interested in this program as a kind of unique Master's of Science. Finally, the Graduate School of Arts and Sciences, which year we are housed under, requires a minimum GPA of 3.0 on a 4.0 scale. That being said, I want to highlight at the bottom that it says we do a holistic review of applications. We have a small cohort size and we really want to get to know our applicants and what draws them to the program. And we also acknowledge that not everyone has the same professional or academic journey. So if you're concerned about any of these eligibility requirements, we really encourage you to reach out to us via our program email, hapi@georgetown.edu, or you can reach out to me because we do have the ability to make exceptions for really promising candidates. So we'd just love for you to chat with us. All right, so those deadlines I was talking about, the priority deadline for application is January 15th for the cohort that would be 2025 to 2026. And this is a great deadline to hit because your application fee is waived and also you will get priority merit aid consideration. You will be considered for both deadlines, but that just gives you full consideration. So that's a good one to know. And that's really great for any international students that might be watching because that gives you more time to coordinate your travel documents to get into the United States. We will review applications going forward on a rolling basis until April 1st, 2025. And any applications after that January 5th deadline have a $90 application fee attached to them. For both deadlines, you will still be in the same cohort should you be admitted, and classes will begin in August 2025. However, please note that as we said before, our summer August session is actually a fall pre-session. So when you're applying for admission, make sure to apply for fall 2025, not summer 2025, if that's when you're looking to get in. All right, and finally, let's talk a little bit about financing your degree. As we said, there is not a confirmed tuition rate for the academic year 2025 yet, so definitely check out the Graduate School of Arts and Sciences website to get a sense of the cost per credit from this year, and keep in mind that there's usually a 3 to 4% tuition increase every year across the university. Our program also offers limited merit-based scholarships for promising applicants, as Dr. Myers mentioned. All applications are automatically considered, so you don't need to submit any additional materials to be considered. But again, we strongly encourage you to apply by that priority deadline of January 15th in order to get full consideration. The majority of our students finance their degrees through multiple sources, such as merit aid and employment benefits. That's one of the reasons we've worked really hard to make the program accessible for people who are working and have a kind of part-time designation. So that if you require something like employer tuition benefits to help finance your degree, we really want you to be able to use those. Hence the reason that most of our classes are now after 4 p.m. The Graduate Career Center also offers a number of great resources on how to find and apply to external scholarships and fellowships. As Dr. Myers mentioned, There are a real host of them across DC, and there are also a lot of positions on Georgetown campuses across the different schools for students to apply for if you're looking for something like part-time work. If you are eligible for Veteran Affairs benefits, you can actually schedule an appointment with the Veterans Service, GU Veterans Service Organization on their website. So I would highly recommend doing that, and they can kind of talk you through that procedure and how to fill out the application process. And whether or not you did this with your undergraduate degree, we really recommend that our students submit the free application for federal student aid or the FAFSA, because grad students are in fact eligible. You could be eligible for federal low interest student loans, and you could also potentially be awarded federal work study, which would allow you to apply to federal work study positions that are designated as such on campus, which are generally just Georgetown University part-time positions. So why not just fill it out, see if you're eligible anyways. If you're looking at the 2025 year, that application should be opened starting on December 1st. Finally, the Georgetown Office of Revenue and Receivables offers monthly installment payment plans for their office, so you can sign up through the billing portal for Georgetown. So a lot of different resources across the institution to help you, and again, we're always here to guide you through that process. All right, so we've said a lot, so now we're going to give the floor to you guys to see if you have any questions. And thank you so much for taking the time out of your day to come hang out with us. All right, we have a hand from Eliza. You're welcome to unmute.
Hi, thank you. Speaking from Edinburgh today, thank you for such a great session. So passionate about this course. Sorry, I'll stick my camera on so it's less cyborg stuff going on here.
No worries.
Thank you so much. Quick question. I come from a geopolitics undergrad, and I'm wondering if that is too qualitative, too much of a social science background, or if you welcome that diversity, quant and qual. Yeah, very, very easy question. Thank you.
No, that would be great. And we actually have students from a broad variety of backgrounds, but I'd say we have more students from social science, psych kinds of backgrounds than we do from hard science backgrounds. Yeah, but we get a diversity, and I'm not sure that we said that the health, and I think we mentioned the health and biology course, but for students who don't have a strong biologic sciences background, we have them take that course. And for the other for students who do, they can just take an extra elective. But students really love that course. It's very focused on health and disease. So it's not looking at I don't know, protozoa or whatever, but it's a much more sort of human disease focused course that's taught very creatively. So that's a fine background.
Yeah, thank you so much for asking that. Next up, we have a hand from Darren.
Hi, thanks so much for the session today. It was really helpful. I have a couple questions. The first one is just kind of how this Master's of Science in Health in the Public Interest degree might compare to something like an MPH. I know MPHs are typically closer to 45 credits in 2 years, but I come from a public health undergraduate degree, so I'm wondering whether you think that something like this might be equivalent. And then I'll hold on my second question.
So let me tackle that one. So it's a great question. Let me first talk about just sort of the difference between our program and an MPH. So in reality, a lot of programs out there are known as MPH program, but if you look at what students actually end up enrolling in, oftentimes they're Masters of Science in Public Health or Masters of Public Health, etc. For example, Hopkins through their Bloomberg School offers an MPH, which a lot of people actually take that, but those are people mostly who are at least a couple years into their career and are taking that program for career advancement. And if someone were to come straight out of undergrad, a place like Hopkins might suggest that instead they sign up for their Masters of Science or Masters of Health or some equivalent program that's not mainly career oriented, right? So the public health world in general is diced and sliced a lot of different ways when it gets down to actual programs. And our program in particular, really isn't meant for people who want to fit the mold of someone who is going to jump right into the public health world and, get an entry-level job crunching data. Researching, policy background for someone who is writing policy or writing papers. We're looking for people who are more interested in making a difference, right? So want to make change. And if you want to be a change agent, and really, advocacy is a word that a lot of programs don't want to use, but we swear by it. If you want to make a difference out there, some of the skills that are super important, along with things like, knowing the field and having good communication skills, along with that, the actual skills involved in advocacy are important to know. So we have a course in that, right? And we have a seminar series that kind of hits all the wide range of things that people that are interested in health in the world are talking about today. It's not just another brick in the wall of like public health information that somebody ought to know, right? So it's kind of a different thing, but closely related. So I would say for somebody who, let's say, has as a long-term goal, let's say a PhD in public health, the thing to do would be to talk to a PhD program in public health. And more often or not, what they're going to tell you is, yeah, you might want to get a master's degree to get additional background. Doesn't have to be an MPH, and you ought to get some experience. We don't take people straight out of undergraduate to our PhD in public health. So yeah, I'm talking too much, but do you want to follow it up and direct my comments or?
Yeah, no, that was really helpful. And I think that makes sense. So I've done my undergraduate in public health and then a couple years of experience, but
Oh,
it sounds
right.
like this would be kind of have a different end aim compared to an MPH, which is something more more in the field of taking action and making change, and that's something that really resonates with me, and I think is a good segue into my second question, which is part of like taking action and making change in the public health field to me is health communications and making sure that people are aware of the information that they need to promote their own health and promote the health of others. And so I'm curious about, I know I saw that health communications is one of the concentration course areas for this program. So I'm wondering if you could speak a little bit more to any faculty that are involved in the health communications field or what coursework and education there is available in that.
Yeah.
Yeah,
So, well,
um,
Lynette Golding, who teaches the health communications course, is she works at Children's Defense Fund, and she involves other people. It's a great course, but she involves other people that she works with to give guest lectures and that sort of thing. And she's working in the field full time. And I have to say, we didn't used to have a health communications course, and the students essentially requested it, and we ended up having it and making it a requirement because it is actually so. It is really important not to just know the evidence, but to be able to communicate that evidence. It's super important. And there are other courses available. I'm not actually too familiar with them, but like Georgetown's really we have a really strong linguistics program here. I know that there's some courses there. Adam, do you know of other like communications courses? Like we wouldn't want you to take something
Yeah.
that's too similar to the one we offer, obviously, but what's nice about it's another distinction between our program and an MPH program is that you can tailor it more to your own interests because there's more elective time. And that sort of enables you to put together more of a tailored program. And while an MPH is a more recognizable degree, everyone recognizes what an MPH is and what's a happy degree. We have to get our students to not introduce themselves as happy students because not everyone understands that that's not the opposite of an unhappy student. But it hasn't kept anybody back from getting jobs, I guess. You might have to explain what your program is to other people. But yeah, we do emphasize advocacy more.
Yeah, so I wanted to back up for a second because I didn't answer part of what you were asking, which was what about your undergraduate public health major. Now, I don't know that we've had too many people with that background, but in my experience, the public health undergraduate degree teaches, a wide array of, health sciences and biological sciences, et cetera, but not necessarily at the same level that we're dealing with it. So we need to sit down with people with that kind of background and specifically, a couple of courses like the methods courses, Dr. Fu Berman would probably want to evaluate, is that appropriate for you to take? If you've had a couple courses in
Epi, biostats.
epidemiology and biostats, maybe that's room for another elective. And as far as the linguistics and communications, so you get some of that in your summer course, sort of the language and
True.
sociology and anthropology of the health field. Um, so, so the woman who teaches methods two is a linguist by training in the psychology department, and and
No, she's not in psychology. She's in
no, I know that. I'm saying
neuro.
that she studied linguistics and psychology for her doctorate, if I didn't make that clear. That's her background is as a linguist. And Lynette Golding, who's also the communications director for Save the Children, is really an excellent resource. So we can work with you to figure out like, the courses in particular that you might take, but we can make room for some extra coursework probably, and we can, develop some mentorship for you.
Thank you so much.
Sure.
Appreciate it.
And we also just had a really great seminar this afternoon. I highly recommend checking those out if anyone's interested, because they are open to the public and you can just email me to get on the mailing list. It's virtually every Wednesday afternoon. We just had one called Advocacy Tools for Outsiders by Dr. Peter Lurie. And he talked about how people outside of the government can make changes in public health and the specific tools to make that change. So there's a lot of really great ways through those seminars to supplement that education on advocacy and communication in the public health field.
Yeah, great
It
point.
was really great.
Yeah, if you attend one of our seminars until you ask to be removed, you'll get on our weekly announcement list, which isn't too heavy of an email load. And really, we have some super interesting people. Dr. Lurie today, I was super impressed by kind of the what he did was he broke down advocacy that people could do in terms of what they can do with the press, what they can do with freedom of information requests, et cetera, and gave examples of how he used them as the president of the Center for Science and the Public Interest to put together efforts to basically change policy or institute new policies, get certain action on drug applications, et cetera. So that's one I was really impressed today.
And you're welcome to come to any of our future seminars. And we, if people give us permission, we have recorded ones on our website as well. But you're welcome to come to our seminars. They're open to the public. Like, part of what we want to do with seminars is give students experience in moderating public talks.
Yeah, and just while you all think about other questions that you might have, we can stay on as long as you want. But I just wanted to interject that we get people who know what they want to do, perhaps, or we get people who are still searching. And this is a great place, as Dr. Fu Berman often points out, to kind of figure out what you want to do in the health world. A lot of people start out as, maybe I want to go into doctoring or nursing or research or whatever. And, fields are by the time you get through college, you kind of have learned a lot about what those fields might really be like. And no, that wasn't for me. I really don't want to be a dentist, right? I volunteered in dental offices and took biology courses. It's not for me. But so maybe it's a place to find yourself. But a lot of times our students kind of know what they want to do. So we get people who are interested in healthcare disparities. That's always a segment. We get people who are interested in LGBTQ issues in health and health justice. We have people with interest in pregnancy justice, in women's reproductive rights, race and health and medicine is one of my favorite topics. Dr. Golding happened to send Dr. Fu Berman and me an article today. If anybody's interested, you can send me an email and I'll send you the link to it. But about a particular medical device and how it was tied into some things that turned out to be kind of institutionalized racism in how we were doing medicine as a country. And if you studied public health or medicine or anything related to it as an undergraduate, you're probably starting to hear about those kind of things, right? About race and or African American renal function and those kind of things. So it's kind of a wide-ranging thing that the students want to do, and we have wide-ranging seminars that will touch on those things. So other questions?
Yes, you can write in the chat or raise your hand or just go off mute. Flexible. And also, if you're interested in looking at our socials, looking at past seminars we've done, I've put those up on the screen.
Hi, how are you?
Hi.
Sorry, I would turn my camera on, but my work laptop does not have a camera. I have a couple of questions, but I want to wait until everyone else has had their questions answered because I already work here on the Midas project and it's kind of related to that. So yeah, I just wanted to make sure you didn't end the call before I ask my questions, but also want to let others ask their questions first.
Any questions from others? Something in chat. Kathleen's asking, do you have students continue on to other degree programs? If so, what support's available for current students pursuing this path? Yeah, we definitely have students. We've had students like have they already accepted to med school who are taking a gap year before that. We've had students who've decided to go to med school. We've probably had more students decide not to go to med school. We've sent students to law school, PhD programs, and a social work. That's kind of a surprising one, but it's interesting seeing students get really solidified during the year and what direction they really want to go in. So yes, some people do go on to further training. In terms of support for current students, both Dr. Myers and I do a lot of pre-med advising. That's we're very used to advising students who want to go on to PhD programs or to MD programs. Less so for law programs, but we've sent I think, at least 2 students to law school. Done very well.
Yeah, maybe more, but
Mm.
Yeah, and you can also take your electives in different schools besides the Graduate School of Arts and Sciences, where we are. Like things like the School of Nursing. Dr. Myers and Dr. Merriman would know the specific ones, but that's also a great way to get a snapshot of those different degree programs and how they would work.
so Anna, do you want to unmute and ask your question?
Yeah, thank you so much. I'm actually a undergraduate social work student, so that's kind of funny that you mentioned that. But I was just wondering if you guys have any like specific graduate like research assistantships or other like opportunities to get involved in research outside of just in the classroom.
Yeah, so we definitely do. You need to be, kind of on your toes and ready to start looking for what's available as soon as you're admitted into the program. They're not in our program per se. Ours is a small program that doesn't exist in a larger research department, but there are fellowships within research opportunities within some of the other organizations. For example, the so I'm forgetting like the name of the organizations, but for example, in the medical center, there are things in the McCourt School of Public Policy. There are occasional things. There are things within the various institutes at Georgetown, um,
And
and also
basic science departments.
yeah, and other programs too. So it's not easy to find something, but it's definitely a possibility, and it's also a possibility to get an internship during the year with some organization at Georgetown or close by.
Great. We have a
Thank you.
question in the chat from Malima, who said that they completed an MSc in mental health ethics and law in 2021 and have found it difficult trying to navigate jobs. They're wondering if this would be an ideal degree to supplement the MSc for more career options in the public health field with specific interests in research or research in mental health care / policy.
Well, first let me say that's a wonderful background for our program. We're interested in issues of mental health and law, and we have had seminar speakers in those kind of areas, ethics included. There's actually a course on in our elective list on mental health and addiction law and policy. So I would say it would help, and not only would it help, but we could possibly, during the course of the program, put you in touch with a couple people like Shelley Weinstein and Shelley Weitzman rather in the addiction policy and practice program that I'm part of, to talk to about that. And yeah, it's
But on the other hand, getting 2 master's degrees is not
right.
it's not necessarily that's an expensive thing to do. So it's something to really think about carefully. So feel free to contact Dr. Myers or me. Yeah, we could talk about this offline, but we would want to make sure that's really the best thing for you.
Yeah, and I actually don't know what the exact type of training that you had in that program is, so and what the goals of that program is. So yeah, let's talk offline.
All right. Any other questions? All right.
So
Yeah, go ahead, Eliza.
Just one final question. I know we're past the time now,
Always.
but thank you. Obviously, I'm coming from a background with a very different type of healthcare system, totally public. So I'm very interested, obviously, in that contrast. I'm just wondering, is your focus solely on the American healthcare system, or do you look beyond and compare and contrast, that kind of thing? Thank you.
Um, Yeah, let's see. So the health economics course is definitely more international, and we definitely have international and global health courses that are available mainly as electives. I mean, some things, like epidemiology and stuff, not really relevant. um, so I'd say, more of a US focus, but it's not just US at all. And you could definitely use your electives for more of a global approach. But I will warn you, coming from a country with a rational healthcare system, we would also turn to you for comment at many points.
Yeah.
So who was it that was asking about did that answer your question, Eliza, or was there more to it?
That's
I think-
perfect. Thank you.
We
Yeah,
also
and
had,
we've had people
yeah.
from the UK in our program before, and
Mm.
Oh,
they fit in quite well.
and I believe Dr. Johnson's talk was related to his work with, was it the British government?
Oh, the seminar speakers have also, we've had a lot of international seminar speakers as well.
Yeah.
But that's what's so great about seminars. Like we can
Yeah.
bring people in from all kinds of fields. And it used to be a live course. We used to drag people down here to Georgetown and without any budget for travel. So they had to be local people and they'd always arrive kind of like sweaty and befuddled because our campus is difficult to navigate. And anyway, so now that it turned virtual during COVID shutdown, and we've loved that because now we can get people from all over, including other countries.
Yeah.
And yeah, that's been really great.
Yeah. And Dr.
So-
Johnson actually works in the global health department too, so he's around.
Yeah. So somebody was asking about or mentioned the Midas project and what they were considering in the future. Who was that?
Maya.
Yeah, that was me. So hi, I just graduated college in May and started working with the Midas Project at the beginning of August. And I have talked to Dr. Weinstein, my supervisor, about this. I am interested in doing sort of like an ongoing project. And I wanted to try and apply and hopefully get into this program. And I know Georgetown is a very generous TAP program that would pay for a master's. But I was wondering if it's possible to sort of be working on a project for maybe before the master's would even start, like a long-term project, and then kind of do a capstone that's in tandem with that, and with the Midas project. Is that something that would be a possibility?
I don't know what the Midas project is.
Oh, sorry. It's with the Center for Population and Health. And it's looking at the influence of psychosocial factors on mental and physical health across the lifespan.
So this is Maxine's project.
Yes, exactly.
I see. Well, we love Maxine. So, I mean, of course, it's possible to continue to do a project while you're here. In terms of the capstone, we really encourage people to actually do something different than they're doing on a daily basis, whether it's work or whether I think a long-term project that you're talking about. In a few cases, in a very few cases, we have allowed somebody to do a project that isn't what they're normally doing and not with the supervisor that they normally have, but at within this same large umbrella of something. We really prefer that though, that people do something different for a capstone.
Yeah.
So
It's a course, it's a 3 credit course. Students are paying money for it. We don't want them to just be doing the same thing that they might have done without that.
Yeah, I understand that. My project is interesting because none of my job role is actually writing or sort of doing an independent study. That's something I want to do completely independently of my work. My work is just doing the grunt work of bringing participants in every day, doing the cognitive testing, taking them to the hospital, doing the physical testing. So I actually don't get any engagement with, exploring my ideas and am writing about them. So that's why but I have access to all of the Midas data because of working on the project. So that's why I was wondering if I could do something like
that
that.
might be possible. Yeah. I'm the one in charge of Capstone, so it's just a matter of negotiating with probably Dr. Weinstein and you.
Okay, cool. I'm
Yeah,
also,
that
of
might be
course,
possible.
open to other things. Thank you so much.
Other questions? Okay, if people have other questions, please feel free to contact any of us. We're a tiny program. Jenny's always available to answer questions, but Dr. Myers and IR as well. So please feel free to write us, or if you want to set up an individual meeting to talk about anything, we can do that too.
Yes, absolutely. You'll see our email on the screen if you want to get in touch with my email, the program phone, or
and there is something in chat from Popula about that, who recently completed a bachelor's in biochemistry in Nigeria, most work experience in research, project focus on medicinal plants and pharmacologic biochemistry. I'm not sure what contributing to the SDG numbers are. We just have to see your record.
Yeah, this may just be a question for admission to see if your bachelor's degree is equivalent to a United States bachelor's undergraduate degree.
Yeah, I would say that, there's a fair chance that you'd be eligible. Admissions would be based on, a closer look at the quality of your grades and experiences, et cetera. So, yeah, sure. If you're interested in the program, go ahead and apply before the first deadline. It doesn't cost anything, and we can give you a holistic review like we give anybody else.
Okay, if anyone else has any questions, please just write us. And thank you so much. Thanks so much for coming to this information session.
Yeah, thank you
Great
everyone.
session. And yeah, sign up for the seminars and you can see how the program works in real life, and see what some of our students look like and sound like as they ask questions and moderate. So
and
thanks.
often students, if you want to talk to some of our current students, they'd probably be willing to talk to you. Jenny can arrange that.
Yeah, reach out to me for talking with students, getting on the seminar mailing list, things like that. But if there's nothing else, then everyone have a lovely night.
Bye-bye.